Discover these tips that will allow you to cure premature release. It is possible to release less quickly. It has often been thought that premature or rapid release was only due to psychological factors, anxiety, stress, depression, etc. However, we now know that release is a reflex and that the muscles of the perineum condition its occurrence. In fact, we could say that release normally occurs when arousal is at its peak. But arousal also responds to physical factors, which explains why therapies to date are as much behavioral as psychological. We take a look at the different methods for slowing down release. What is premature release? Premature release is characterized when it occurs early, for example, too quickly and consistently. During intercourse, the patient is unable to hold back his release, and intercourse rarely lasts more than a minute. In itself, this is not serious and does not affect health. However, it becomes a disorder when the man who suffers from it feels deeply unwell. Thus, the psychological consequences of premature release define in its own right. It is estimated that 20 to 30% of men suffer from premature release. It is therefore the most common release-related problem. The different approaches to slow down release. Several approaches have been developed in recent years to treat premature release. Some methods focus on the mental and psychological aspects of male emission in order to help control arousal. Other methods target the physical functioning of the body, in particular the muscles of the perineum, in order to learn to use them voluntarily and not involuntarily. Other approaches rely on the use of treatments, tablets, anesthetic creams to be applied to manhood's tip, which help delay release. The importance of comprehensive work to treat premature release. Researchers want to know which method was the most interesting for treating it. The important thing to remember is that there is not one method that is more effective than another. They can all be interesting depending on the individual and his or her difficulties. As summarized by therapists, the mistake has often been to oppose approaches or treatments, whereas by combining them, we often obtain better results. So today, during therapy, doctors often recommend the use of a medical treatment, in particular to regain sensations more quickly in order to make the body and psychological work more interesting. The idea is to be able to modify this emission reflex in the long term. The importance of being followed by a therapist. It is also for all the reasons we have mentioned that a follow-up with a therapist is interesting. He or she can adapt methods used at each stage of treatment in accordance with the evolution of the problem. Not everyone will respond in the same way to the same treatment. A therapist can therefore adapt the methods used to suit the patient. How to come less quickly. Anxiety is often presented as the major cause of premature release, and it is true that men having this problem often have a more anxious nature than the average man. As a rule, lifestyle is a determining factor both in intimacy and in everyday life. Sometimes it is simply a matter of readjusting habits. In the case of premature release, it is a reflex. Involuntary, changing this reflex can take time and work. But as the therapist informs us, the ideal is to combine treatments based on exercises and techniques to learn to control the emission reflex. In addition to medicinal treatments, the combination of different treatments seems to bring better results. Playing sports to relieve stress or anxiety. It is difficult to know whether it is anxiety that causes early release or the other way around. And perhaps there is another issue that can cause both premature release and anxiety. In any case, anxiety can be relieved in various ways, including through a healthy lifestyle, balanced diet, regular exercise, restful sleep, relaxation, etc. Yoga, for example, is an interesting way to learn to meditate while strengthening your muscles. But all sports are good for your health. and you will quickly notice the positive effects of regular exercise. If, despite everything, you are having difficulty getting rid of the anxiety, psychological help from a psychologist or therapist is bound to be beneficial to you, whatever problems you are facing. What are the psychological causes of premature release? The psychological hypothesis in the occurrence of male emission is very strong. For example, we have noticed that premature release can occur in some men depending on the situation or context, the partner, after certain life events, grief, problems in the couple's life, etc. All these clues suggest that psychological factors play a role in premature release. Here again, it is possible to carry out exercises with a therapist. This allows you to re-educate your mind so that you can approach the intimate act calmly and regain self-confidence. However, advice such as think about something else during lovemaking is often ineffective. It is not enough to say to yourself, I am thinking about something else for it to work. It is often the opposite. Therefore, during therapy, exercises aimed at working on the mind with a view to better controlling release are rather focused on meditation, mindfulness, paying attention to feelings, emotions, body sensations, without trying to hide them. Beyond psychological problems, it is possible that your precocity is due to erectile dysfunction. If you want to be sure, fill in the questionnaire in the description and you will have the answer in less than 5 minutes. What to do in case of hypersensitivity of manhood's tip? Some men seem to have hypersensitivity of manhood's tip from a neurological point of view. This would explain, for example, why release does not occur during foreplay, but why direct stimulation during intercourse accelerates the onset of release. Lady part lubrication and the feeling of warmth can also be natural factors in favor of early release. Moreover, from a reproductive point of view, early release was supposed to increase the chances of reproduction and thus the survival of the species. But since intimacy is separate from reproduction, premature release can be a problem for some men. Treatments for hypersensitivity of manhood's tip are based on anesthetic creams, sprays, gels, etc., to be applied locally before intercourse. They reduce the effects of stimulation of manhood and thus make intercourse last longer. There is a drug of this type available without prescription, Forticin. It will treat your sensitivity problems at the time of intercourse to make your tip less sensitive and prolong your intercourse. Premature, a pill to slow down release. There is a pharmacological treatment for release that is too fast. Premature, whose active substance is duloxetine, is a drug belonging to the class of serotonin reuptake inhibitors, SRI. It is a member of the antidepressant family of drugs, without the psychotropic effect. Premature is frequently used in the treatment of premature release. Recent studies have shown biological differences in neurotransmitters, particularly serotonin, between men who come too soon and those who do not. There, therefore, seems to be a biological or even genetic cause of premature release. Take your time during the first thrust. Performing the first thrust gently can allow manhood, and particularly the tip of it, to get used to a new environment, heat, lubrication, etc. Indeed, we know that the tip is particularly sensitive to all these parameters. Rapidly entering your partner's lady part can lead to a too rapid release. So taking the time to enter gently the first time can help delay release and make the pleasure last rather than having to slow down the pace later in the intercourse. Strengthen the perineal muscles. These muscles are involved in the contraction and relaxation of the urinary sphincter, but it also seems to have a role in the occurrence of release. In fact, it is the contractions and tensions of the perineal muscles that trigger release. It is therefore possible to learn to relax these muscles in order to better control one's release. The muscles of the perineum are easily identifiable. they are responsible for the evacuation or retention of urine. It can therefore be interesting to learn how to relax them when urinating. This will help to identify the muscles responsible for the release and to know how to relax them during intercourse in order to come less quickly. Other exercises aim to strengthen the perineum. The famous Kegel exercises, practiced regularly, can delay release in some men. They can also treat overactive bladder and urinary incontinence. It is therefore by working on the physical but also on the mental and psychological aspects that the treatments for premature release are most useful. In fact, according to the therapist, 90 days is the ideal time to unlearn the emission reflex. As premature release has generally been in place for a long time, it is natural that a little work is needed to correct this reflex. And besides, a patient's perseverance is often the key to success in treating this issue. 90 days, therefore, to better control one's arousal, strengthen the perineum muscles, and on a larger scale, learn mental techniques that allow one to come less quickly. Differentiating between statistics and reality. However, therapists tell us it would be a huge mistake to think that the ideal intercourse duration is 7 to 15 minutes, and that it necessarily takes twice as long beforehand. The figures given by these surveys are statistical averages. They are not standards, rules to be respected. And that's understandable, because sometimes you can last in bed for hours on end, without even having intercourse, and just enjoy the caresses or whatever, and the pleasure will be just as good. At other times, a very quickie one is also very pleasurable. The following times, one can alternate rhythms, caresses, intercourse, return to one or the other, etc. So, making love cannot follow precise rules. Don't judge yourself by the average length of intimacy. Only your satisfaction and that of your partner count. Spontaneity, for example, is more important than the length of the intimacy. Why should you seek help for premature release? Premature release, like rigidity dysfunction for example, is often a source of embarrassment and stress for men who suffer from it. Still taboo, these subjects are difficult to discuss. Being premature is wrongly associated with a lack of virility. The man can then shut himself down in a love life that does not satisfy him, often causing a drop in desire. However, as we have seen, there are solutions to improve control of release. Coming too quickly is not inevitable. A consultation with a doctor is then necessary in order to set up a therapy or any other treatment protocol which will allow men to come less quickly and to remedy this disorder. What you need to know about slowing down your release. Many methods or products are sold on the internet to improve intimal function and particularly premature release. However, few of these methods have been proven to work. Different behavioral techniques exist to last longer in bed and come more slowly. There is the squeeze technique, pressing on the manhood's tip when release is imminent. The stop and go technique, stopping the back and forth movement just before the point of no return in order to bring down the level of excitement. The use of a condom with a delaying effect, etc. For a long time, these techniques focused on certain physical aspects, forgetting the psychological part. Today, therapists recommend a multidisciplinary approach to the treatment of premature release. For personal advice and/or treatment of intimate difficulties, contact a therapist. Taking care of your intimate health is very important for your well-being.